think the session was really helpful to kind of open understanding how people who are deaf can work in the outside world when there isn't the same level of communication that we normally have.
Yeah, and I also thought it was interesting to think about the barriers that could be involved in GP practice and healthcare and what we could do to make it better for the patients.
I learned that where possible, really use your facial expressions and use gestures to kind of mime things. And if you are speaking with an interpreter, to keep your eye contact with the patient and just allow the interpreter to do the interpreting on the side. That way you can kind of build a rapport and the deaf person can communicate with you better as well.
I liked learning the different the useful gestures that we had in the sign language that we could use.
It is very important because obviously in the medical profession, whether you're just communicating whether someone just needs some blood tests, you might also be breaking quite bad news. You might be having to discuss quite sensitive topics. Being able to communicate it to the best of our ability, including gestures, using bits of BSL, is really important to us to be able to do our job better and make the patient feel better in themselves.